Good evening, everybody. Thank you so much for tuning in to me and Ian Wright, veterinary surgeon, parasitologist, all-round extremely knowledgeable man about worms.
Yep, worm lover. That's what I am. Yes, absolutely.
Somebody has got to love these worms.
Well, they do. They do. And that's me.
That's you. Thank you so much for the worm love.
No, that's right. That's why I love orthopedic surgeons. So I don't have to do all of that. You know, it's all good.
I couldn't agree more. I must find my own worm passion. Well, this is what it is. It's about, This is my passion. It's about spreading the word. And tonight we're spreading the word about worms, and we're spreading the word about worm egg counts, because we need to treat our pet, and we're talking specifically about cats and dogs this evening. We need to treat our pets against worms on a regular basis for their health, but also for human health as well, don't we?
Yes,
and
absolutely.
I am seeing recommended and discussed more and more using worm egg counts. So taking samples of feces and sending them away to a lab and looking for worm eggs in the feces as an alternative to just giving your pet a wormer.
Yeah.
And what I really want to know, and what I have looked into and actually haven't been able to find, is some reliable, independent information about how reliable worm egg counts are, how accurate they are, how much we can rely on them for our pets and our family's health. And, you know, should we be doing them? Should we just be worming our pets? The wormers that we give to our pets are incredibly safe, really super effective, not terribly expensive. So why should we be considering another way? And then, you know, and so then the only man to answer all of those questions is Ian. So thank you again, Ian. I really am very grateful for you joining us.
It's my pleasure. As you know, I'll talk about worms all evening. So you just fire away and it'll be good to go.
So let's start with the really basic. What is a worm egg count in our cats and our dogs?
So the thing is, with the exception of tapeworms, which are generally quite big, and they pass these segments that, you know, frankly, livens up my Monday morning. If I'm doing a cat spay and a little tapeworm segment wanders out of bottom, that is class, you know. But many people don't feel the same way, you know, and that is a very visible evidence that there's a worm infection present. But I think what a lot of people understandably don't appreciate is that roundworms, so the other sort of big type of worm that lives in cats and dogs, pass eggs that are microscopic. So they're passed in the feces. We don't know they're there. And we very rarely see the adult worms. The adult worms are parasites. They'd much rather be on the inside, living the intestinal dream, you know, sheltered from light and the horrible outside world. We very rarely see them. So, you know, the only way really to know that they're there, apart from the odd puppy or heavily infested cat or dog that will occasionally vomit up, you know, roundworms or pass them in their feces, the only way to know that they're there is to test the feces for their eggs. And we do that by, well, there's a number of different ways that we can do it. But essentially, most of them are a form of what we call fecal flotation. So if we just looked in the poo, if we just put a bit of poo under the microscope, there's all sorts of stuff in poo that's just going to get in the way. So undigested plant material, there's going to be little bits of bugs and, you know, all sorts of stuff that just pass through the intestines. We're not going to be able to see the eggs. And the eggs, although there are lots of them, you know, if you've got grams and grams of feces, they're going to be quite difficult to find. So the idea of fecal flotation is actually beautifully simple. You just put the poo in a solution where all the stuff you don't want sinks and the worm eggs float. And then you look at it under a microscope slide, you find out if any worm eggs are there. So that's essentially how fecal flotation works. I should say, for the sort of sake of fairness, there is now another way. There are tests that look at fecal antigen. So that's looking for little bits of the adult worm that's been shed in the feces. So that's another way to look for infection. But most people, if they're sending their feces away to get sort of, you know, to look for sort of worm eggs in their pets, it's going to be some form of fecal flotation that we're looking at.
And is that just roundworms that we can do that on, or are there more species of worms that we can do that on?
In cats and dogs, it's mostly roundworms and tapeworms. And in tapeworms, the evidence tends to be there in the segments that are being passed. Now, there's always the exception that proves the rule. There's a tiny little worm called Echinococcus granulosus that's a tapeworm that doesn't pass segments. But mostly, tapeworms, it's segments, roundworms, it's eggs. And it's those roundworm eggs that we're looking for.
And you can have perfectly healthy poo out of a perfectly healthy adult dog, especially, that will contain millions. Is it fair to say that egg counts are in the millions in with the roundworm?
They can be, potentially, and particularly an adult dog, is potentially going to look fine. Intestinal roundworm infections in dogs and cats are actually incredibly well tolerated. And if they cause disease, if they give diarrhea, bit of the runs, bit of failure to thrive, it tends to be as a sort of combination of other factors. So, you might have sort of upset tummy for another reason. You might have other infections on board. You might have food sensitivities, and they're all going to add up to diarrhea. You have to have an awful lot of worms in cats and dogs to make them sick on their own, intestinal worms. The big exception isn't an intestinal worm. It's something called lungworm, Angiostrongylus, which is a dog worm that lives in the arteries around the heart. It can make dogs very sick. But when we're looking for worm eggs, the intestinal worms, generally the pets stay pretty healthy. Our biggest worry is, well, partially we want to prevent them building up in huge numbers where they're going to cause disease. But the main worry is the most common roundworm in cats and dogs, Toxocara, is infectious to people. It's what we call zoonotic. So these eggs are passed in the feces. They're not immediately infective, so you can't immediately get infected if feces has just been passed. But these eggs mature, like a fine wine. They need to develop, need a little worm to develop inside, and then they're infective in the environment to people. So, children playing in sandpits, public parks, sports fields, very big problem with dog fouling, this sort of idea. So a lot of the reason that we use preventative treatments in cats and dogs is to prevent this zoonotic risk. It's not necessarily to, because we think that the cats and dogs are going to get terribly ill.
Yeah, so it's more for human health in a lot of cases. But of course, those roundworms, if your dog's shedding roundworm eggs in their feces, or your cat is, they're infectious to people, but they are infectious to other pets, other animals as well. And thus the cycle of worm continues. So if we go back to the worm egg counts, we're doing the fecal float. I think that's probably the vast majority of like labs where you send the poo away, isn't it?
Yeah, definitely.
How accurate, do we know how accurate those tests are? Like, if we get a negative result back, how likely is it that, let's take each worm at a time, how likely is it that a dog is going to be negative for roundworms if a negative fecal result comes back?
Well, there are a lot of positive cases that are going to fall through the cracks, and that's going to happen for a number of reasons. That's no one's fault. It's just the way these eggs are shed. So first of all, they're not shed uniformly every day. The worms, they might have a day off. There might be no eggs shed, and then the next day there's lots of eggs shed. So this is one of the reasons that we ask owners to collect pooled samples over, say, 3 days to maximise our chances of catching these eggs. But even if that's done, it's not guaranteed that your sort of positive dog is going to shed eggs in that time. And that's one of the reasons that fecal antigens was developed to try and get around that. So, sort of shedding happens sort of on and off. That's the sort of first thing. The second thing then is that you've got to get enough poo that you've got some of these eggs in. So ideally you're looking between sort of 1 and 5 grams of feces. So
not very much then.
That much poo in a pot, probably. But sometimes fecal samples can be hard to get hold of, and sometimes, people, bless them, will come in with, like a match head of poo. That might not be enough. That's going to limit the sensitivity of the
But
test.
equally, we don't need to be sending sacks and sacks away.
No, I don't know a lab on Earth that will complain if they get too much. It tends to be if they get too little. But we don't need a mountain of it to work with. Just one goodly dollop, and we're away. So that's But if you haven't got enough, that can limit the sensitivity of the test. So how likely it is to find these eggs. And then the last bit is how well these eggs are going to float. So it depends on the solution you're using, and it depends whether you spin the solution down and then refloat it or not. And that is actually quite a crucial step in increasing the chances of detecting these eggs. So to give you an example, there's a wonderful centrifugation technique called flow tack. So, some vets may send the feces away to Langford. I think down in Bristol have got a flow tack machine, and that will spin them to death before floating them. And that increases the sensitivity massively. It can detect 1 egg per gram sort of flow tack. So you've got that at one extreme. And then another extreme, you'll have people who will just use a bit of flotation solution. They won't spin it at all. They'll just pop the feces in, give it a little shake up. And that is much less sensitive than say, flow tack. So how you actually carry out the procedure really matters. And that's going to affect the sensitivity. But I mean, overall, as a general flotation that's been spun, you may be looking at picking up, say, 2/3 to 3/4 of all positive cases. That sort of ballpark.
So if we get a negative count, there's a 30 to 40% chance that actually it's positive.
Yeah, absolutely. Yeah,
so
and that's
really, that's quite high, I would suggest.
Well, it is.
Quite an inaccurate test. There's not many tests that I would want to send my patients away for that had a 30 to 40% chance of being wrong.
Well, it's a useful screen. That's the thing. So if you get a positive result, well, even this isn't entirely true, but if you get a positive result, most of the time you can be confident it's a positive result. The exception is if you've got dogs and cats that eat feces, because if they eat other animals' feces, those eggs might be passed through. But putting that to one side, if you get a positive result, you can be reasonably confident it's positive. It's just, a test is as valuable as knowing its limitations. So as long as if you get a negative result, it might still be positive, then it's still worth running. And if you run these tests regularly, then sooner or later, if your pet's positive, you're going to pick up a positive result. I think perhaps, again, because of the way testing is framed, people assume that if they send one sample off and it's negative, that there's nothing there. Well, that, is far from certain to be the case. So if testing is going to replace, say, routine treatment for Toxocara with its human infectious risk, it has to be done very frequently, maybe sort of 4 to 12 times a year, because otherwise shedding could be taking place in between your tests. That's sort of one of the big drawbacks.
So we need to be if you wish to go down that route, you need to be testing your pet as frequently as we would treat them against worms. Yes, and even if we get a negative result, we need to keep our eye on the ball and keep testing on a very regular basis.
And we need to be, we need to understand as pet owners and vets that even if we're testing that often, if we're not treating, there could still be shedding of these zoonotic eggs in between. So, if it's being used as an alternative, sort of pet owners need to understand that there is some risk, however small, in taking on that strategy.
Yeah. So if we can test for them, but if we don't treat for them, we're still going to we're still at risk of worms, aren't we?
Yeah, so absolutely.
Treating for roundworms, there's the SCAP guidelines of which you are the director. So the European Scientific Council? No, you'll have to tell me. I've forgotten.
No, you were right. You were right. It's the European Scientific Council for Companion Animal Parasites. It is
There
a bit
you
of a
are.
mouthful. That's
So you're the guys who make the recommendations, aren't you? So what's
yes,
the SCAP
absolutely.
guideline? Let's just do roundworm for starters. What's the SCAP guidelines on either testing or treating for roundworms?
Okay, so you have to bear in mind that there's sort of national advice and there's the European guidelines.
Let's
So
stick with
there
the
is
UK.
there is a bit of a European. I should explain. There is a bit of a European split here. If you go to Scandinavia, just routinely treating for stuff is just viewed as heinous. You know, you want a diagnosis and then you're going to treat for it. And that's very much how they're set up. So they would take, you would hope, that the very frequent testing approach. Here in the UK, I think that the zoonotic risk posed by Toxocara, absolutely validates a routine treatment approach. And I should explain, what we haven't explained is that most puppies and kittens obtain this infection at birth. So the worm crosses the placenta in the case of dogs, and then in the case of cats and dogs, it's transmitted through the milk. So almost 100% of puppies and kittens start off, with this parasite. So,
which is why worming for them is so important. We don't
absolutely.
start our puppies and kittens off testing them. We can just assume they're infected and get them wormed. Because these worms, like you said at the beginning, can actually, although our adult pets are very tolerant of them and can carry a worm burden and look fine and have normal poo and not lose weight and great appetite and all of that, but in our puppies and kittens, they can actually make them really, really poorly, can't
absolutely. They can have really huge numbers courtesy of mum, and it doesn't matter, really doesn't matter how well wormed or treated mum is, there's always some of these worms in reserve that are going to cross that milk and then infect the puppies and kittens.
Because these are the ones that live in the mammary glands and can cross the placenta as well, aren't they?
Yeah, absolutely. So they hide out in the body, and this is what happens. So, this is why we recommend all puppies and kittens are wormed every month up until 6 months old. Now, at 6 months old, the immune system kicks in, and a lot of these worms are sort of, given the boot, they're either expelled or they're absorbed. But a small percentage of them sometimes can hide out in the muscles. And this can happen throughout the pet's life. They can be topped up through eggs or through hunting little furry creatures that have eaten the eggs or birds. This is how cats get a lot of Toxocara infection, by sort of hoovering up the local wildlife.
I always think of it as the mouse's revenge from beyond the grave.
Yes, that's it. Yes.
But his worms live on.
Have some of this, before I expire. Bit of toxoplasma to boot, but that's another session. So that's the way cats tend to get topped up quite a lot. But even if they're not topped up, they can shed these eggs on and off their whole life. And that's why this sort of frequent testing, if you weren't going to treat, is so important. Let's assume we are going to treat. That'd certainly be national advice because of the zoonotic risk. You want to treat adult cats and dogs at least 4 times a year, because from very limited evidence, that's the minimum frequency that we know reduces egg shedding. But you have to treat every month to prevent egg shedding, or 90% plus of egg shedding. So if you've got high risk individuals, so if you've got young children who are at most risk of getting toxocorosis, or the sort of immune suppressed, the very elderly living with these dogs or in regular contact with these cats and dogs, then you want to worm them every month. And if they're hunting, you want to worm them every month. And if, say, they're on raw, unprocessed diets, you want to worm them every month. So, if they're high risk, you want to keep worming them every month. And the reason for that is that although 4 times a year reduces shedding, so it's quite good for the greater good, for the sort of number of eggs in the environment as a whole, if you're in a sort of enclosed environment, so if you've got your dog pooing in your garden, these eggs will live forever. I mean, they'll survive in the environment for years in the soil. So, they gradually build up over time. Even if they're only being shed very gradually, they'll build up in numbers over time. And that's why treating high-risk cats and dogs every month is so important. So that's our advice. But our advice is also that you test alongside. So, if you're treating your pets every month, you want to know that that treatment's working. You want to know that you're administering the product okay. And, just say doing a fecal test once a year will give you that reassurance. Now, we've said a single negative result doesn't mean you're definitely negative. But if you pick up a positive testing regularly, then perhaps there needs to be a shift in your regime. And this is especially important if you're only worming 4 times a year. So, doing this regular testing will tell you whether 4 times a year is enough. But
and should
it's
we be,
regular
so
testing.
do you say we should test alongside treatment? Are we testing 4 times a year, or are we testing
Well, so this is the thing. So if we're alongside, then the more you test, the better. I'm never going to say, oh, you can test too much. You can't test too much. But even if you're testing once a year alongside treatment, it'll help to demonstrate sort of efficacy of the product and the regime that you're using. And particularly then, say, if you're sort of taking a risk-based approach, for sort of, other parasites, just doing a sort of fecal test sort of once, twice a year alongside treatment will just demonstrate that your treatment regime is working. And this used to be really hard. You used to get these, you have to send them off to external labs. It used to take time to get the results back. But they're increasingly, there's a couple of different ways now. That fecal antigen testing is very straightforward to do now, to collect in practice. And there is a new artificial intelligence that reads the slides for you that's been launched. I know it's like a wonder of the modern age. So all of these things are making testing in practice easier. So, if you wanted to introduce testing alongside your preventative regime. But, we often
need to treat them.
Yeah, so, we often get asked whether this could be used as an alternative. And the answer is yes, but the testing has to be frequent and pet owners have to understand it's not a risk-free strategy. So, however often you're testing, shedding could happen in between. That's the thing.
Yeah, precisely. So even if you choose to worm count for roundworms, we should still be treating for roundworms anyway, and you can use the worm count as a sort of a backup, like a peace of mind, knowing that even if it comes back negative, there is a reasonable chance it might not be, but you can use it. But it's not a replacement, because I often see it recommended as a replacement. If you're worm counting, you do not need to treat against worms. So actually, that's not entirely the case, really, is it?
Well, the way to look at it is that if you decide you're going to test instead of treating, and you send your dog or your cat species off, and it comes back positive for Toxocara, that means your cat or dog has already been shedding these zoonotic life stages, and they've been shedding them potentially for as long as since your last test. So it's not a risk-free strategy. By the time you realise that eggs are being shed, they've already been shed for some time.
Yeah.
So, the advantage of preventative treatment for Toxocara is that it eliminates that immediate zoonotic risk. I mean, yes, another cat could come and poo in your garden, good hand hygiene, sort of dog, sort of picking up sort of dog species responsibly. All of these things are very important as well. But preventative treatment is a huge component of controlling human toxicrosis.
Well, yes, not only for your pet's health, but for the health of the people around you,
Exactly,
and all the other pets around you as well. So, worming our pets, it could almost be seen as like our public duty, sort of a public health duty.
Yes, I view it that way, but from a very personal point of view, zoonotic risk, particularly if you've got young children, I think isn't something that you want to live with. So, I have 2 dogs. And I mean, I've got, 2 boys who are perhaps old enough that hand hygiene should be coming in, but it's all a bit variable. So for that reason, I have my 2 on monthly roundworm treatments. And, it's purely to manage that potential risk.
Yeah. But I think we shouldn't frighten people. Like, do you have any figures on how common Toxocara infections in people actually are? Do we know it?
Well,
I mean, we all hear those I think there's those terrifying stories, aren't there, of children who go blind, particularly,
yes,
or lose their sight. But that is only a handful of cases every year. But are there a lower level of infections?
Well, in terms of frightening people, so there's 2 different things, 2 different questions there. So we shouldn't frighten people because it's really easy to avoid Toxocara. I mean, if you're washing your hands really well, if you're, sort of washing your raw sort of vegetables, raw sort of, salad stuff that you've grown in the allotments, you've got a spring onion, and you pull it out and you look at it and you think, oh, I've grown that. I might just try it. You might just want to give it a rinse first in case a cat's come along and defecated on it. So, that sort of, washing, good hand hygiene, picking up and disposing responsibly of dog feces, covering sandpits so cats can't poo in them because they love sandpits as a latrine.
Just a great big litter tray in the garden.
Yeah, exactly. And routine, sort of preventative worming. If you do those things, the risks are going to be incredibly small. And you can still have, a wonderful relationship with your pet. You can hug it, you can play out in the garden, and any infectious risks are going to be really, really small. And it should be said, really simple things like good hand hygiene, washing fruit and vegetables intended for raw consumption are going to block transmission of other parasites like toxoplasma that there is no preventative treatment for. So, doing these really simple things is going to keep everyone safe. And if you're doing those things, the risks are going to be, really, really small, almost infinitesimally small. In terms of national figures, though, that's a big problem. So, I should explain what toxocorosis does to you. We haven't really talked about that. And, the effects are many and varied. So, I mean,
he's going to tell us.
Well, I'd like us all to avoid these consequences. That's the thing. But it is a remarkable parasite, and it just wanders around your body. It sort of treats us as a paratenic host, like the little mouse or the bird. It sets off and it decides it's going to lodge itself somewhere in our body. And the most famous place it lodges itself is at the back of the eye. And that's the really easy one to diagnose. So, particularly in this day and age, it used to be mistaken for cancer. There were some terrible stories about misdiagnosis. That almost never happens now. You get a worm at the back of your eye, that is going to inconvenience you. You're going to go to your doctor, and sooner or later, somebody's going to have a look and it's going to get diagnosed. So those are the cases that tend to get
down the ophthalmologist.
There's a worm in that eye, and diagnosed, jobs are good. So, but that tend to be the ones that get reported, and you're looking at only a handful of cases in the UK each year. So, often the sort of pushback, if you like, is, well, look, that Ian is going on and on about toxocorosis. It's a handful of cases every year. The problem, though, is that all the other things that Toxocara does is a bit vague. So you can get something called visceral larval migrans, where it travels through the organs and it can cause breathing difficulties, abdominal pain, sort of chronic headaches. You can get something called covert toxocorosis, where you're antibody positive and you feel rough. Are the two connected? And there have been links between toxocorosis and epilepsy, dermatitis, asthma, learning difficulties, cognitive dysfunction. And, it doesn't directly cause all of these things, but if you're positive for Toxocara, you're more likely to develop them. But if we just stick, with the visceral larval migrans or the covert toxocorosis, you've got abdominal pain, or you suffer from chronic headaches or chronic fatigue, first step is you've got to decide to go to your GP. You've got to be, I'm not going to put up with this anymore. I'm going to go to the GP. So that's some positives lost straight away. We'll just never go to their GP. You're then going to go to your GP and say, look, doctor, I've got this abdominal pain. I've got a chronic headache. You've then got your GP has got to go, oh, hang on, that could be toxicorosis. Now, we can imagine that's a pretty big jump. Probably a fair few.
A long way down the list of things.
Yeah, that's it, you know. But let's assume that your GP does that. He's then got to diagnose it, which I'll tell you is not easy. You know, there's a lot of NHS tests presumably got to take place to diagnose Toxocara. And then having done all of that, it's not a notifiable disease. So the person who's actually diagnosed it has then got to decide to proactively report it for it to count as a case. So you can see there's a lot of steps from I'm feeling pretty unwell to it being listed as an official case where cases are going to be lost. And where I'm heading with this is that we simply have no idea really how common Toxocara is in the UK. I mean, the World Health Organization acknowledges that, you know, it's just, well, it's a hugely underdiagnosed disease just because of its vague symptoms, how difficult it is to pin down. So that's the short answer, is that we don't know how many people are exposed in the UK. And more data would be really useful to try and find that out. But what we do know is that pets shed these eggs. It's not good for you. It's probably something that you want to avoid, getting a Toxocara egg. And that there are really simple solutions to hopefully avoid us doing that. Yes. So, you know, that's generally the view that we take.
Simple and cheap and safe and effective.
Yep.
And
absolutely,
you know, and worm egg counts aren't a replacement for them for roundworm.
Yeah.
So there was a couple of other things I wanted to cover. So one thing that I often see is that, you know, we really do rely on worm egg counts in other species. So we rely on them particularly in horses. A lot of people will have a horse, and it's very routine to do a worm egg count before you worm your horses. I presume that's because the worm is different, not because is it the testing, or what's why is it not so standard in our dogs and cats?
Well, the simple answer to that is that there is no zoonotic risk with horses. So there's far more selection pressure, what we call selection pressure, in horses and ruminants. That means drug resistance develops far quicker. So there needed to be a solution because multiple drug resistance was developing. And, you know, one of the sort of, you know, clear ways to try and target treatment in horses and ruminants is to find the ones that are shedding the most eggs. And that's where fecal egg counts come from. So if you've got, the idea is that if you've got ruminants or horses that are shedding low numbers of eggs, you leave them, they contaminate the pasture with those eggs, and then, you know, you've got some stages being shed that haven't been exposed to wormer, and that slows down resistance. Where if you treated everything all of the time in that enclosed group, resistance would develop very quickly because you're treating all the worms. They're all being exposed to the wormer, and only the ones that can fight the wormer off survive. So you can see how very quickly resistance develops.
And that's because we have our horses and our cows and everything in herds, don't they?
Yeah,
they
exactly.
live in the field all together, or they live in groups all together. And that's so one of the reasons why is because they're not infecting people, so it's not quite so important that we clear those infections completely. And the second is we can encourage resistance. So how about that in our dogs and cats? If we worm our dogs and cats monthly, if they're living with, you know, children or immunocompromised people, are we going to encourage worm resistance in our dogs and cats? Is there any evidence of that?
So we're very lucky in that resistance has been very slow to develop in cats and dogs, and where it has developed in intestinal worms, again, it's been groups of kennel dogs that have been very intensively wormed in the same way. So they're almost acting as sort of horses or ruminants in that situation. And it's tended to develop in hookworm, because those are the worms they're trying to get rid of in kennelled environments. So it's been slower to develop for a number of different reasons. The main one is that we have wildlife reservoirs. So if we look at Toxocara, it's carried by lots of foxes, huge numbers of foxes infected with Toxocara. So you've got a wildlife reservoir there. Same with hookworm, lots of foxes carry hookworm. In the case of lungworm, which we haven't covered, but that has a huge fox reservoir, and it's in slugs and snails as well, lots of slugs and snails. So you've got huge reservoirs that we're not targeting with wormer. Even when we're targeting cats and dogs, though, the Toxocara has what's called these arrested stages that are in the muscles. That's where they come from and then come through the milk. And it's very difficult to get rid of those with wormer. So our standard worming regimes don't eliminate those worms. So again, you've got some that aren't being exposed to the wormer. But the main reason is that we're not all, there isn't a coordinated campaign. So we're not all sitting down and saying, oh, we're going to worm all of these cats and dogs on the same day with the same wormer. We're all sort of worming them on different patterns in different parts of the country with probably about, 6 or 8 different types of drug, different types of anthelmintic. So all of that together slows resistance. The thing is, though, that even if that wasn't the case, it's the zoonotic aspect that makes it very, very different in cats and dogs. So people say, oh, well, we should only select, the really high risk cats and dogs, and we shouldn't worm the others because we're worried about resistance. You don't limit resistance by not treating uninfected pets. If you don't treat cats and dogs that don't have any worms, nothing's changed. You only limit resistance by not treating the ones that are going to pump eggs out. And if you do that, you're allowing these zoonotic eggs to be passed into the environment. And that is a very, very tough ask. So you're going to say to pet owners, well, for the greater good, we'd quite like to not worm your pet. And it's going to pass out some eggs that, are going to develop. They might make someone sick, but we're going to do that because we still want our wormer to work in 20 years. That is a tough sell, a very tough sell. And I think although we need to be vigilant, which is one of the reasons it's important to keep testing, I think although we need to be vigilant for resistance, and if it started to develop, there are other ways we can try and limit it, like rotation of wormers. Ultimately, our first responsibility is to animal and human health. And if you've got high-risk pets, for the human health aspect, and in the case of lungworm, for the dog's health, we have to worm every month. So unfortunately, we're kind of boxed in there in a way that sort of equine and large animal vets aren't.
But it sounds like that, although we should remain vigilant, and as far as I'm aware, there is vigilance happening, and worm egg counts can have a role in that vigilance of resistance, can't they? Because if people do start worm counting, then we can look at it more on a population level. But as long as we keep an eye on it, it sounds like the resistance risk is fairly low.
At the moment, it is low, but I can't stress enough that vigilance is really important. And if we didn't do any testing, if we just use the routine treatments and we're never testing feces, then we'd never know. It would carry on, and until something sort of fairly major happened, we'd have no idea. So even for an individual pet, it's very important to know that a product is working. So even if it's just that once a year test, you can be certain that it is working for your individual pet, rather than just giving the treatment every month and we're just assuming, that it's doing the trick.
Yeah. So I think that's what we're sort of coming to, isn't it? That, although worm egg counts, I see them touted as an alternative to wormers, because I think there's a lot of And it's understandable. I think a lot of people are fearful of chemicals, and it's not natural, and side effects, of which there really aren't significant ones. And these drugs are very, very safe. I see it advertised as an alternative, but it's not, is it? It's a complementary, both for your pet and for the wider population.
Yes. Yeah.
So they're not
They
bad. You
would-
just have to understand actually what they're achieving.
yeah.
So we've talked extremely extensively about roundworm because they are a potential for infectious to people. Tapeworm, I guess there's no point in fecal sampling, is there? Because tapeworms shed their worms in these little worm packets that they're the like moving grains of rice, aren't they, that come out?
Yeah.
And I guess unless you scoop up a moving grain of rice and send it off to the worm count, your dog or cat could have tapeworms, and it'll come back. Do worm egg counts even test for tapeworm? Do they say we've tested and there aren't any tapeworm, or are
the thing is, they do look for them. I mean, you look for everything. Sometimes you find some really weird stuff, and it's quite exciting.
You'll never find it.
Yeah, exactly. But tapeworm eggs don't float at the same concentration as roundworm eggs. So, generally on fecal flotations, you don't find them. And people are starting to work on what's called copper antigen or copro PCR tests that look for bits of the worm, not for these big tapeworms that we're talking about, things like flea tapeworm or livestock tapeworm, because they're big tapeworm segments that are coming out. You're going to know, if your pet's got them. But it's this worm called echinococcus, which is another zoonotic worm, causes something called hydatid disease. It's only a few millimeters long, and it passes its eggs in the feces. So, for that parasites, they are trying to develop these new tests that are starting to become commercially available. There is a commercial in-house PCR test now for echinococcus. The problem with echinococcus is that there isn't a lot of surveillance that's gone on. I mean, we know it's in Wales. There'll be Welsh vets and possibly some Welsh pet owners that will be familiar with hydatid and the risks. But we don't know where it is in England and mainland Scotland. And we know it's out there, we're just not quite sure where. So again, complementary testing, as it becomes easier, will be useful. But tapeworm routine treatment is a risk-based approach. So unlike Toxocara, where all cats and dogs are going to get Toxocara at some point in their lives, you have to work a bit harder to get tapeworm. So, your echinococcus and your sort of livestock tapeworms, dogs get them by eating raw offal and raw meat, essentially. Mostly, some of it is unprocessed raw feeding, which is becoming a more common practice. But a lot of it traditionally has been eating bits of sheep in fields, sort of fallen livestock, or hunts and farmers just chucking raw offal out as a bit of a treat. That's been how the life cycle's been maintained. Unprocessed raw feeding, though, is opening up a new avenue for its transmission. But essentially, if your dog gets up to any of those things, then you should be treating it monthly for tapeworm. That's the thing. And if you're not sure, again, 4 times a year is sort of a good halfway house. For cats, I mean, they get it through hunting. And to be honest, cat tapeworm has no zoonotic risk. It's pretty well tolerated by cats. It's mostly that people don't want these segments crawling up their furniture or, in their bath or wherever else the cat is, which is a completely reasonable thing to want to eliminate. But again, it's only really your active hunting cats or flea tapeworm, where they get it by eating fleas off their coat. So, then you want adequate flea control. But, it's only really these high-risk cats and dogs that require routine treatment for tapeworm. If you've got a Chihuahua that you walk about on a short lead, or, lives in your sort of, carry-all, and it's on a sort of processed diet, it's on a cooked diet, then you don't need to tapeworm. You're going to be absolutely fine.
Yeah. Okay. So, but we should say that all standard wormers do tapeworm, don't they? So we don't need to think about, as pet owners, you don't really need to think about these worms terribly individually, because if you're worming against, well, you can get wormers that just do tapeworm and not the others. But if you're worming against, if your vet gives you a wormer, it's going to do all the intestinal worms.
Well, so this is where the risk assessment is very important. So there are lots of flea treatments that do roundworm as well. So if you're not at risk from tapeworm, you may not need a sort of separate worm treatment per se, at all. But, equally so, a lot of the risk factors for Toxocara are the same for tapeworm. So if you're on a monthly roundworm treatment for Toxocara, if it's a tablet, odds are it's going to do tapeworm as well. So yes, you're absolutely right. You can cover both of those, bases together.
And what about the headliner of lungworm? Because that is the worm that I think a lot of people have heard of. A lot of people are very worried about. There's been a lot of publicity around the complications that lungworm infections can cause in pets. They can make them sort of hemophiliac, so they can't clot their blood. They can give them, coughs and things like that. Again, those very serious consequences aren't hugely common, but they are a risk.
Absolutely.
Do worm egg counts, how accurate are they for lungworm?
Well, so lungworm is the exception when it comes to egg counts, because it passes live larvae in the feces. So you can look for those larvae, but you need a special test. Something called the bearman's apparatus, which I love. It's like a sort of funnel where it's got a little sort of pipe attached to the bottom of it. You can build it Blue Peter style-y in your practice. I've been to government institutions with lines of bearman's apparatus, and no two are ever the same. They've always just been cobbled together by whatever was in the kitchen. They've all been put together. And very briefly, all they are is they're a funnel full of water, and then there's a bit of pipe that comes out the bottom, and that pipe is sealed by a bull clip or similar clip. And what you do is you get a nice bit of cheese gauze or a swab, and you wrap the feces up and you suspend it somehow, maybe with a little cocktail stick, in the funnel of water. And, the poor larvae, they think, oh, we're drowning. So they all swim out of the feces, and then they sink. And they all sink, yeah, that's it. And then they're like, oh, down they go, down the funnel they go. And of course, because you've got the bull clip, they all accumulate at the bottom. And every so often, you just draw off some of the fluids, spin it down, have a look at it under the microscope, and you see what you've got. And that's the sort of bearman's. I mean, essentially, its pros and cons are the same as fecal testing. So, the larvae are only shed intermittently. So, sometimes you get them, sometimes you don't. But, it is a very good test. There is, for routine screening for lungworm now, an alternative, which is a blood antigen test, which only needs a tiny amount of blood. You can run it in-house, and it'll pick up about 5 in 6 cases. So it's pretty good. So, either of these can be used again for sort of screening suspected cases and for sort of, routinely testing dogs, which I think is very important, particularly in high prevalence areas, either before surgery or as part of your sort of booster sort of wellness check. In terms of routine treatment, it's risk-based again. So dogs get it by eating slugs and snails, occasionally frogs that act as sort of parotenic hosts, even birds. There's been a chicken that's been demonstrated to be positive for angiostrongylus. Yeah, even a chicken. Most dogs will just get it from munching their way through slugs. And some dogs will do it because they love it. My eldest dog does it because she loves it. Some will do it because they eat grass. And some of the slugs are really tiny.
Yeah, they can be really weeny, can't they?
Absolutely, yeah, smaller than a 5p piece. So they'll get accidentally eaten with grass. And then you've got the supreme irony that some slugs like eating poo. And often then, while they're eating the poo, they'll be accidentally eaten by coprophagic dogs that will just come along and just eat the whole, dollop. So,
That's like a worm
coprophagia.
cocktail.
Exactly. Yeah, it's like the
smorgasbord.
whole gourmet dish there. Yeah, that's it. And sometimes slugs will drown in water bowls, and then they'll accidentally get eaten while they're drinking water. So essentially eating slugs, coprophagia, grass eating, cereal grass eating, are sort of lifestyle risks. And then there's certain parts of the country where lungworm is far more prevalent. So traditionally, that's in London, Greater London. 3 in 4 foxes are positive for lungworm. So so it's really, really high prevalence area. Some parts of Somerset, Wales, quite high prevalence. But it's very fluid, so it'll sort of catch fire in one little area and then it will die out, then it might move to another area, it sort of gradually consolidates. The reason this is important is that the testing will tell you whether it's in your local area or not. So this is a classic example of when testing is just so important to tell you where the lungworm is about locally. So it's a mixture of sort of lifestyle risks and geographic risks.
Yes, there are maps, aren't there, where you can look at lungworm hotspots. So, but to continue to pull on the thread of the point of the talk, I think most people who send off fecal samples to labs that provide that service or to companies that provide that service, those companies aren't the SNAP test. The 5 out of 6 positives is a blood test, isn't it? It's not.
Yes, that's a vet test. It's not a fecal test.
How accurate is a bearman's? Do we have figures on if your dog is reported as negative for lungworm, what's the likelihood that is actually the case?
Well, again, it's hugely variable. So bearman at its best is the gold standard. Bearman at its best, there is nothing more accurate than bearman. But for bearman to be at its best, you have to have fresh feces. If you've got feces that have been left on the ground, even for more than 60 seconds, all the sort of free living microscopic worms will think, oh, this is an all you can eat buffet, and they'll all jump in, and then you'll do your bearmans. You won't be able to see. I've seen this before. I mean, you wouldn't believe it, but you just can't see for the number of worms in there. And they're all free living worms that have all jumped in the fecal pad. So,
wow.
Yeah.
So the 5% rule really does count.
It does. It does count here. Yes, absolutely. If you're straight down there, you're going to be okay. You leave it there for a minute, it's been overrun. So fresh feces, pooled feces, so it needs to be collected over 3 days, so fresh samples. And then it very much depends on the skill of the person doing it. And it is one of those where there is a bit of a knack. And certainly in identifying the worms, there's a lot of a knack. So the more experienced you are, the more sensitive the test is. But crucially, and this is absolutely crucial, is that a lot of the disease in lungworm happens before the larvae are shed. It's what we call pre-patent disease. So, often the horse has already bolted by the time you detect the worms. So I would really implore people, if they're in a high-risk area, if their vets are seeing a lot of cases, or your dog just eats slugs like they're going out of fashion, you need to be on a preventative treatment. Don't wait to get a positive. Potentially something really quite unpleasant could happen to your dog while you're waiting to get a positive. So, yes, testing is very, very important, but your vet will take these risk factors into account before recommending treatments. And if you're not sure, don't take it at face value. If you're not sure, say to your vet, well, if I'm getting lungworm treatment, why? And they'll explain. They'll say, look, we've had lots of cases in the local area. Or, you'll say, look, that dog ate 3 slugs on the way in, and it'll say, look, this dog clearly needs preventative treatment for lungworms. So, it's a conversation that you can have, with your vets.
Yeah. But again, lungworm is, it fairly easily prevented to sort of 95%, cleared, isn't
Oh,
it?
yeah. I
With,
mean,
you can
the
get spot-on
treatments we
treatments or
use.
you can get wormers. And especially if a lot of the wormers, if they're used monthly, are very effective. The tablets are pretty effective against lungworms. That's the case, isn't
Well,
it?
there's obviously we can't go into treatment options, but there is an excellent group of licensed spot-ons and tablets that are like nuclear weapons. If you're a lungworm, and they'll clear you out. So if your pet is high risk, then there are very effective preventative treatments that you can use.
Amazing. Thank you so much. So we did a talk 2 weeks ago about foreign rescue dogs and the parasites that they can have. And we talked for an hour and I said, Ian, I'll see you in a fortnight. We'll not talk for an hour about worm egg counts. There can't possibly be enough to talk about. Anyway, we've been going for nearly an hour. So
there you go. What did I say? I said it's exciting. We'll be here all evening. You see,
it's fascinating. It is fascinating. So we've had a few questions. So I thought if we can just answer the questions, then wrap up, and we'll try to stick to the hour because I'm so grateful for giving us your time. It is absolutely
my pleasure.
Amazing. So the first question was, should we consider worming our children or ourselves as protection? Should we be recommending clients to do this if they have high risk pets? So should we be worming ourselves in addition to worming our pets? If we've got
no is the answer. So the reason is that it's migrating worms through the tissues. So if you get toxicrosis, then worming will be part of your treatment. But it's going to be treatment alongside anti-inflammatories, potentially sort of, specific treatments for the pathology that you're showing. There is absolutely no evidence that preventative worming in people makes any difference. So we tend to get wormed for pinworm. We've all well, I don't know who of us are prepared to admit, but I'm sure as young
parents
children
and probably dealt with that.
Yes, we might have, in our children or ourselves had itchy bottom syndrome, and that's what you tend to get treated for is human pinworm. But there's actually, remarkably few worms transmitted from pets to people that actually end up in your guts as a worm. So for that reason, routine worming,
no. And then one other person says, I send lots of fecal samples from dogs with diarrhea and very few come back with worms, lots of Giardia and Campylobacter. Well, thanks, pandemic puppies. I'm diagnosing Giardia, which is a different parasite entirely, hand over fist at the moment. So does that mean then the test isn't picking up lungworms, or do none of these dogs have worms? I guess I don't get a lot of positive. When I send fecal samples away on my patients, I rarely get a positive for worms. But I guess that's probably because they've probably been wormed. Like if you've got a puppy with diarrhea or a dog with diarrhea, it's one of the things that is done first, isn't it, before we test?
Well, yeah, so there's a few things there. So first of all, if it's lungworm, you won't be testing for lungworm if you've got diarrhea. A standard fecal float won't pick up lungworm. In terms of intestinal worms, they can contribute to diarrhea, but they actually very rarely do. So you're more likely to pick up a worm in a diarrhea sample than you are in a standard fecal sample. And I mean, again, we dearly, if anybody fancies doing one, we dearly need more prevalence studies. But from the last one that was done, we think maybe about 1 in 20 dogs and about 1 in 4 cats are shedding eggs at any one time. So every time you send a fecal sample off, it's like a 1 in 4 and a 1 in 20 that dog's infected. And then, we've already established that, it's 2/3 or 3/4 of those are going to be detected. So if you're only doing diagnostics in clinically ill animals, then the chances of you picking up a routine worm infection are actually quite low. It's only when you start testing larger numbers of pets and you start doing it regularly that the worms will start to appear. I mean, that is, of course, opposed to Giardia, which is everywhere. Diarrheic pets, healthy pets, huge prevalence of Giardia. Yeah. So, that's why we do tend to pick up Giardia all the time.
Yeah. Okay. So, we've got questions coming in thick and fast now. Okay. Are you all right to answer another couple
Yeah,
of?
absolutely. Yeah,
All right. I
absolutely.
think this is quite a good one. It's what about environmental concerns associated with anti-parasite treatment of small animals? So there's a mention there of the flea treatments in British waterways. Now we could talk for an hour or more on that.
We could, yeah. Let's
But
come back and do that another
so
time.
we're here. So I feel like let's just not open that can of worms about fleas, if you will allow the pun, because that's a to do that question justice. I think we can't do it in 30 seconds. We're not avoiding it, we just can't do it.
No.
However, I do think it's a reasonable question to ask, what's the environmental, if we're feeding our pets wormers, they're passing those wormers in their feces. Obviously the majority of feces is going to be collected, but are those chemicals shed in the feces? Do they have an environmental impact on wildlife? Do we know that? I think that's a reasonable thing that we should.
That is a very reasonable question. So
Yeah.
the first thing to say is that some of them, particularly the sort of macrocyclic lactones, so some of the ones say that we use to treat lungworm, some of those are going to be shed in the feces. And there's a lot of concern in livestock and sort of horses where these are used a lot about the knock-on effect on dung beetles that are then going to go and collect those cow pats. And
I didn't realise we had dung beetles in the UK. I thought they were David Attenborough see them collecting poo on the plains of Africa, and I very recently realised we have dung beetles here, and I was very, very excited.
I am ashamed to say this is not something I've given a lot of thought to, but I'm happy too. I love a good dung beetle, and nobody wants dung beetles to come to any harm, so that is a legitimate concern. So in terms of addressing those concerns, first of all, it's another good reason, one of numerous good reasons that we could also spend 10 minutes talking about why you should pick your dog poo up. So you pick your dog poo up and then it's not going to contaminate the environment. You are going to leave a little bit behind. You always leave a little bit behind, but you can be picking up 95% of that. And you can Yes, you can encourage cats to use litter trays. Some are going to poo outside. That is a difficulty. So, the second aspect is it should be risk-based. So we shouldn't be treating all pets for everything all of the time. The big exceptions being fleas, and we can talk about that another time, but also Toxocara. So I think a minimum of 4 times a year for Toxocara. But whether you should be treating cats and dogs monthly for Toxocara, whether you should be treating them for tapeworm and lungworm is a risk assessment. So, we shouldn't be over treating, but we need to make sure we're not putting people and pets at unnecessary risk. And there's always going to be I
think that's fair. There's a balance. And as long as we are being vigilant and we are looking for resistance and we are monitoring the environment, then that's okay, isn't it? We've got to keep an eye on these things, but you're absolutely right. It's all about the balance. Ian, one final question that I think you're going to absolutely love. What would be a good parasitology study subject to embark on? What area needs more research?
Oh, yes. Please. I would implore practices out there. And if they need any help, feel free to contact me. But what we need is prevalence studies for egg shedding or for, presence of worms, if you prefer fecal antigen. So, we don't know. People always come back and say, well, how much Toxocara shedding is there? How many cats and dogs are shedding Toxocara? How many are shedding hookworm? And we don't know. Absolutely no idea, because studies in the UK have been very limited. I say we don't know. I mean, there are studies done around the world, and we know there are certain risk factors that increase the risk. But here in the UK, we don't know. And, the 2 things that we really need more evidence for is how much environmental contamination is going on. And those studies are really hard. They have to be done by universities and governments or groups like the VMD. Or, we can look at how much parasites there is in cat and dog populations. And that is something that we can all get involved in practice. So, if you do in-house fecal antigen testing, or if you do in-house sort of fecal analysis, fecal flotation, then start recording those results. And, either with the help of groups like ESCAP or on your own, you can publish them. And if lots of people started to do that, we'd start to build up a picture of what there is in the country. And that would be hugely useful.
That's amazing. So I think what a perfect point to end our discussion on, because I asked Ian here for very selfish reasons, basically, because I keep seeing worm egg counts being touted as an alternative to wormers, more safe, more natural. And I wanted to find the answer. Is worm egg counts is that something I should be recommending to my clients? Is it a reliable alternative? And the answer is no, it isn't a reliable alternative. We should continue to protect our pets. We definitely need to treat our puppies and kittens. There's no point in testing in worm egg counting them. But where worm egg counts come in helpful is to see where worms are and how many we genuinely have within our population, to know what the risk is, and also to keep an eye on the fact that our worm treatments are actually working and we're not developing resistance, because we need to keep an eye on that. So Ian, thank you so much.
A closing remark is a colleague of mine in a well-known lab says everybody loves parasite maps. They love to look at maps and see where parasites are. But you only get maps if people test. No testing, no maps. And that's very true. So that is reason enough for us all to do a bit more testing.
Yeah. So if you want a map, if you want to know how many Toxicara are in your locale, then you need to test.
Let's have a look. Yeah, absolutely.
But it is not a safe or reliable alternative to just worming your pets.
No, there you go.
Not been wormed recently. Go and have a test for it. Yeah. That is wonderful. Thank you. Thanks, everybody. Thank you so much for sticking with us.
Thanks for listening, everyone. Yes,
Ian, absolutely. As always, it is it's just such a pleasure to chat to you, and your enthusiasm and your knowledge.
The pleasure's been all mine.
All mine. And it is so brilliant, because I think this is really, really amazing information to get out, both to the veterinary profession and also to pet owners. So thank you so, so much. Guys, thank you ever so much for watching this video. As soon as we've finished, will be available to watch on my Facebook page. So you can go right back to the beginning and watch it all again. Yeah, and if you haven't already, go and watch the chat we did a fortnight ago about foreign rescue dogs and the parasites that they can have and what we need to do about them, because that was absolutely fascinating. I have never had so many positive feedback on a talk that I have ever done. People were
that's wonderful. I'm glad,
messages, and so many people really love that talk. So if you haven't watched it, guys, go and watch it. But for this evening, honestly, I thought this would take half an hour. Anyway, thank you so much, everybody. Good night.
Take care.